Welcome to Expert Living, your trusted source for all things health and wellness. Whether you're navigating the complexities of a chronic condition or looking for expert advice to live your best life, we've got you covered. Today, we're focusing on a critical issue that affects millions of people around the world: how diabetes increases the risk of heart disease and, more importantly, the steps you can take to reduce this risk. If you have diabetes, or you know someone who does, it's essential to understand the dangerous relationship between these two conditions. In this in-depth video, we'll explore how diabetes damages the heart and blood vessels, why this risk escalates over time, and practical steps you can take to safeguard your health. Stay with us to learn valuable tips that could be life-saving. How diabetes affects the heart. Diabetes is not just about blood sugar. It's a metabolic disorder that can profoundly impact multiple organ systems, including the cardiovascular system. People often think of diabetes as a condition that primarily affects the way the body processes glucose, but in reality, its effects extend far beyond that. High blood sugar levels over time can have a direct and severe impact on your heart and blood vessels. When glucose levels are consistently high, they lead to what's known as endothelial dysfunction, which impairs the normal functioning of your blood vessels. This dysfunction causes damage to the thin layer of cells lining your blood vessels, making it more difficult for blood to flow freely through your arteries. Over time, this damage leads to the buildup of fatty deposits known as plaque. Plaque narrows the arteries and can block blood flow, creating a condition called atherosclerosis, one of the major precursors to heart disease. This narrowing can result in severe complications such as heart attacks or strokes. In fact, according to research, people with diabetes are 2 to 4 times more likely to develop cardiovascular disease than those without the condition. Moreover, heart disease is the leading cause of death for people with diabetes. Understanding these statistics is critical because it underscores the need for early intervention and ongoing management to reduce your risk. But how exactly does diabetes cause this cardiovascular risk? It all starts with elevated glucose levels. When these high levels persist, they damage the blood vessels and the nerves that regulate your heart and blood circulation. This damage occurs silently, meaning you may not feel the effects until it's too late, which is why it's essential to maintain regular checkups and monitor your health closely. Blood sugar and cardiovascular risk. A dangerous connection. One of the most insidious aspects of diabetes is how blood sugar can silently wreak havoc on the body, especially the cardiovascular system. Many people with diabetes may not experience immediate symptoms of heart problems, which leads to a false sense of security. However, damage is occurring beneath the surface, often without noticeable signs. Elevated blood glucose over a prolonged period creates an environment where your body's blood vessels are under constant stress. Inflammation becomes chronic, and your arteries start to stiffen. When your arteries stiffen, a process known as arteriosclerosis occurs. This condition makes it harder for your heart to pump blood efficiently throughout the body. The arteries lose their elasticity and narrow, and as plaque accumulates inside them, the risk of heart attacks and strokes increases significantly. It's not just about stiff arteries, either. Diabetes also affects the smaller blood vessels, which leads to microvascular complications that can affect organs such as the kidneys, eyes, and nerves. The heart muscle itself may also suffer from what's called diabetic cardiomyopathy. This is a condition where the heart muscle becomes thickened and less efficient at pumping blood. High blood sugar levels contribute to this dysfunction by damaging the heart cells and the blood vessels that supply the heart. Over time, this strain on the heart can lead to heart failure. For people with diabetes, the challenge is that these processes are often happening simultaneously. You may have damage to your blood vessels, increased inflammation, stiffened arteries, and weakened heart muscles, all without any obvious symptoms in the early stages. The role of inflammation and insulin resistance. Inflammation plays a significant role in the connection between diabetes and heart disease. Chronic inflammation is a hallmark of diabetes, particularly type 2 diabetes. When the body is constantly dealing with elevated blood sugar levels, it triggers a persistent inflammatory response. This inflammation can cause further damage to blood vessels, promoting the buildup of fatty deposits within the arterial walls. In addition to inflammation, many people with type 2 diabetes also experience insulin resistance, which means their body's cells aren't responding properly to insulin. This leads to higher insulin levels circulating in the blood, which has been shown to negatively affect cholesterol levels. Insulin resistance is linked to elevated levels of LDL cholesterol, the bad cholesterol, and lower levels of HDL cholesterol, the good cholesterol. This imbalance in cholesterol levels is one of the key drivers behind the development of atherosclerosis. Inflammation, insulin resistance, and abnormal cholesterol levels form a dangerous trio that significantly increases the risk of cardiovascular complications. This makes managing both blood sugar and cholesterol levels a top priority for individuals with diabetes. The impact of high blood pressure on cardiovascular health in diabetes. It's not just high blood sugar that poses a threat to the cardiovascular system in people with diabetes. High blood pressure, or hypertension, is another major contributor to heart disease, and it often goes hand in hand with diabetes. Hypertension increases the force of blood pushing against the walls of your arteries, which can cause them to become damaged over time. When you combine high blood pressure with the other cardiovascular risks associated with diabetes, the danger multiplies. Hypertension accelerates the development of atherosclerosis, as the force of high blood pressure can make existing plaque in the arteries rupture, potentially leading to blood clots. These clots can block blood flow to vital organs like the heart and brain, resulting in heart attacks or strokes. In fact, the combination of diabetes and high blood pressure is so dangerous that people with both conditions have an even higher risk of cardiovascular events than those with only one of the two. It's vital for individuals with diabetes to keep their blood pressure within a healthy range. Ideally, blood pressure should be lower than 140/90ths of a millimeter of mercury, but your healthcare provider may set a lower target based on your specific health needs. Managing blood pressure can require lifestyle changes, medication, or a combination of both. It's also important to recognize that hypertension often doesn't have obvious symptoms, so regular monitoring is essential to prevent complications. How to reduce the risk of heart disease if you have diabetes? So, what can be done to mitigate the risk of heart disease in people living with diabetes? Fortunately, there are several evidence-based strategies that can significantly lower your cardiovascular risk. By taking a proactive approach to your health, you can improve your quality of life and reduce the likelihood of serious heart-related complications. The first and most important step is to control your blood sugar levels. Whether you have type 1 or type 2 diabetes, keeping your blood sugar within the recommended range is essential for reducing the risk of complications, including heart disease. This means adhering to a treatment plan that may include medications, insulin, and continuous glucose monitoring. Diet plays a crucial role in managing both blood sugar and cardiovascular risk. A heart-healthy diet for people with diabetes should be rich in whole foods, including fruits, vegetables, whole grains, lean proteins, and healthy fats. Fiber is particularly beneficial, as it helps regulate blood sugar levels and can improve cholesterol. Conversely, it's important to limit processed foods, trans fats, and sugary beverages, as these can spike blood sugar levels and contribute to the buildup of plaque in the arteries. Exercise is another key factor in reducing cardiovascular risk. Regular physical activity helps improve insulin sensitivity, lower blood sugar levels, and strengthen the heart. It also promotes healthy weight loss, which is especially important for people with type 2 diabetes. Aim for at least 150 minutes of moderate intensity exercise per week, such as brisk walking, swimming, or cycling. If you're new to exercise or have other health conditions, consult your doctor before starting a new routine. Weight management is essential, as obesity increases the risk of both diabetes and heart disease. Losing even a small amount of weight, just 5 to 10% of your body weight, can have a significant impact on your cardiovascular health. The importance of medication in managing cardiovascular risk. In addition to lifestyle changes, medication plays a critical role in managing the risk of heart disease in people with diabetes. Many individuals with diabetes need to take medications to control blood sugar levels, blood pressure, and cholesterol. These medications may include insulin or other glucose-lowering medications, essential for maintaining healthy blood sugar levels. Statins. These drugs help lower LDL cholesterol and reduce the risk of heart disease. ACE inhibitors or ARBs. These medications are commonly prescribed to manage blood pressure and protect the heart and kidneys from the damaging effects of diabetes. It's important to work closely with your healthcare provider to determine the right combination of medications for your needs. Medication adherence is crucial. Taking your medications as prescribed can significantly reduce your risk of heart disease and other complications. Quitting smoking. A critical step for heart and overall health. If you have diabetes and you smoke, quitting smoking is one of the most effective things you can do to protect your heart health. Smoking is particularly harmful to people with diabetes, as it compounds the damage to your blood vessels and increases the risk of cardiovascular events. Smoking raises blood pressure, reduces oxygen levels in the blood, and accelerates the process of atherosclerosis. The good news is that it's never too late to quit. Within just a few months of quitting smoking, your heart and lung function will begin to improve, and your risk of heart disease will start to decrease. There are many resources available to help you quit, including counseling, nicotine replacement therapies, and prescription medications. Regular monitoring and medical checkups. Living with diabetes requires ongoing attention to your health, and regular monitoring is essential for preventing complications. This includes monitoring your blood sugar levels, blood pressure, cholesterol, and other cardiovascular markers. Regular checkups with your healthcare provider allow for early detection of any issues, which means that problems can be addressed before they escalate. It's also important to undergo routine screenings for heart disease, including tests like an EKG or stress test, especially if you have other risk factors for heart disease. Your doctor may recommend additional tests, such as a coronary artery calcium scan, to assess the level of plaque buildup in your arteries. Conclusion: diabetes and heart disease are closely linked, but with the right strategies, you can reduce your risk and live a healthy, fulfilling life. By focusing on controlling your blood sugar, managing your blood pressure and cholesterol, quitting smoking, maintaining a healthy diet, exercising regularly, and adhering to your medication regimen, you can protect your heart and lower your chances of developing serious cardiovascular complications. Thank you for joining us today on Expert Living. We hope this video has provided you with the information and tools you need to take control of your health and reduce your risk of heart disease. Don't forget to like, subscribe, and hit the notification bell to stay updated with our latest health tips and expert advice. Stay healthy, stay informed, and we'll see you in the next video. This is Expert Living, your trusted guide to a healthier, happier life. See you next time.